Good afternoon, everyone. Dear audience and our esteemed speaker of the day, Mr. Dharmesh Mehta. I, Gauravi Parab, on behalf of Alumni Association of VES College of Pharmacy, welcome you all for GPAT in today's live session. Words of guidance are those little lamps that enlighten our path, and so is our eminent speaker of the day. He is an alumni of our college. He has worked He has worked with NDDS Department of CIPLA and is currently associated with Kangwal Chemicals. He is also a founder of Pharmalite, that is GPAT and NIPER coaching classes in Mumbai. Sir has done his masters from NIPER Hyderabad with a GPA of 9.62 and has achieved an All India rank 484 and NIPER rank 66. He is always a click away through his YouTube channel, which guides us on how to prepare for GPAT. He is also a speaker at IPA-MSB and various colleges, which include SVB College of Pharmacy, LHH College of Pharmacy, Bombay College of Pharmacy, MET Institute of Pharmacy, and of course, VES College of Pharmacy. He has also completed many certified courses from WIPO, NIDA, UMC, and Udemy. Sir himself and all his achievements hold a proof for words quoted by Anatole France. To accomplish great things, we must not only act, but also dream, not only plan, but also believe. With this note, let's get into our today's session. Over to you, sir.
Good afternoon, everyone. First of all, a big thanks to Alumni Committee for giving opportunity for this talk on strategy for GPAT NIPER preparation. A big thanks to Anita ma'am for helping for conducting the entire session, and of course, majorly the ground team who works in and out right from link preparation to thumbnails and everything. So, warm welcome to all our participants today. A big thanks to Supriya ma'am for giving opportunity to share my thoughts for strategy for GPAT NIPER preparation. Being an alumni of Westcop, I especially feel that at Westcop we have always got the best resources to study, best guidance in. And yes, sometimes it has been to a great extent that we have always been taken a stage ahead compared to what was the requirement, being exposed to industrial knowledge, being guided on the things which are required at industry level and not just at academic level. So when it comes to Westcop, I suppose we have the best exposure when it comes to any college across Mumbai for preparation, not only for semesters but also getting ready for industry, also getting ready for different competitive exams, let it be for post graduation in India or let it be abroad. The faculty team has been great on par to guide all of us on a different note altogether. Focusing on today's entire session, next 40-45 minutes, I'll be talking on strategy for GPAT and NIPER preparation, which is just one of the entrances for post graduation. And it's not the only entrance, obviously. We all have a lot of questions in our mind. It may be like, why do I go for post graduation? Is it having a good scope in India? Is it having a better scope abroad? We all are in a big question mark. So I suppose that entire bunch of questions, whether GPAT NIPER or whether MBA or whether Pharma MBA or Core MBA, is the major doubt in all of us. And I suppose that should be given a bigger priority when it comes to Q&A. So when we'll talk about question answer sessions at the end of the entire session today, I'll focus more on those particular parts rather than GPAT NIPER because I'll be talking about GPAT NIPER any which ways during the session. Meanwhile, I'll just suggest you whatever queries you have, you can keep posting it in the chat box. We'll be more than happy to answer them all. With regards to strategy for GPAT NIPER preparation, most of us are always being said that GPAT is very tough. You cannot get a good rank in GPAT, you cannot qualify GPAT. GPAT has 4 years of syllabus, a lot of myths around, which probably are different and will vary from one to one's opinion. So if you ask someone who has got a GPAT rank in top 100 or a NIPER rank in top 10, they would tell you that GPAT NIPER was easy. On the other hand, someone who has been a topper throughout their entire bachelor's, I mean, B.Pharm, but they couldn't qualify GPAT, they might have a different angle. And then comes the third person in the picture who was never good at ACATS, who never got a pointer above 7.5, 8.5, but they were strong at concepts. And when it comes to GPAT, especially NIPER, it's all about application. It's not about the theoretical thing, what we usually put across in our theoretical papers. So yes, when it comes to GPAT, NIPER, other competitive exams, let it be for BITS, Manipal or anything, at all those exams, you need more of an application point rather than the theoretical point. At the same time, you don't need to write short notes. Like most of us fear pharmacology or organic chemistry. We fear pharmacology because of those big mechanism of actions, many other points in ADRs भी याद रखना है, classification भी याद रखना है. But on the other side of the picture, GPAT Sniper is not asking you to write short notes. You don't need to know the entire MOA that वो कौन से receptor पे act हुआ, which channel opened up, which ion came out, what was the action. No, you just need to know that last one line that, like if I take example of local anesthetics, what you need to know is just that local anesthetics blocks sodium ion channels. That's it. There is no need for you to know entire thing वो कौन से receptor पे act करता है, कैसे जाता है. No, just need a one line. That's where the difference comes. When you're preparing for any postgraduate entrance, not only GPAT NIPER, it can be any other entrance of Manipal bits or anything. At that particular stage, your methodology of preparation is supposed to be different compared to your semester method. If you apply the same things at both the ends, you don't expect a different result. You probably might get a qualification score, but might not be in top 10. And जब कुछ सोचना ही है, जब कुछ करना ही है, then why not dream big? Why to just think of qualification? I know many of us around who just aim just qualification, but stipend मिलना चाहिए. Yeah, I talk about that stipend as well, 12,400 and all those stuff. But most of us just focus on that amount. We are not bothered about what rank we are getting. But qualify ho jao. I want to remove that mentality because basically things are not that tough, provided we know the direction to head on. Problem is that we go haphazard. We are being said that GPAT has 4 years of syllabus, so we ourselves are very much on the lower track. 4 साल का एक साथ कैसे पढ़ूंगा? While that's not the case, to be honest, things are not that difficult as much as they have been portrayed. I'll talk about how it can be made easy. Stay tuned. Post your doubts in the chat box. We'll be more than happy to answer them all. Talking about just a brief introduction about GPAT, I hope you might be aware about the full form, graduate pharmacy aptitude test, and all. I don't want to focus much on that. I just want to focus on some advantages which we all are looking into at present. Firstly, when it comes to GPAT, as we are aware, GPAT has 125 questions in total for 3 hours. So for 125 questions, you are going to get 3 hours for preparing for GPAT, attempting your paper, I mean. For every correct question, you get 4 marks. So if you attempt a question and if it goes correct, you get 4. If you attempt a question and if it goes wrong, there's something known as negative marking. So you don't lose 4, you lose 4 plus 1, 5. Lastly, if you don't attempt a question only, अगर question attempt ही नहीं किया, in that case you lose only 4. So if you attempt and if it goes wrong, you lose 5, which is negative marking of 25%. We all had this negative marking in our NEET GEE entrances. It's the same negative marking of 25%, nothing different. Now, what are the advantages if you qualify GPAT? If you qualify GPAT, then you are eligible to get a stipend of 12,400 rupees per month from government, provided you don't have any ATKTs during the semester and your attendance is on par. Even you have a KT, then you get those pending months stipend together once your KT is cleared. It's not that you don't get only. Only if you qualify GPAT, then you can write NIPER. It was just like your 12th standard JEE mains and advance. You qualify one, then you can write another one. Unless and until you qualify GPAT, you cannot write NIPER. So if you are GPAT unqualified, you cannot write NIPER. Next important thing which I would like to highlight greatly is most of us realize in our third year or final year that I want to go for GPAT NIPER. They get through GPAT, they get through NIPER, but they are unaware about one of the criteria for NIPER. That criteria is your aggregate pointer, your average pointer of semester 1 to semester 7 or 8 should be greater than 6.75. If your average pointer of SEM 1 to SEM 8 is not greater than 6.75, then you are not eligible for NIPER even if you qualify GPAT. This pointer is a must category if you want to attempt your NIPER exam as well. Many of us are unaware about this. Third year में आके we come to that okay ऐसा कुछ criteria है. By the time we know we have hardly 1 or 2 semesters to bring our average pointer to this level. So for those who are in second year, third year, it's an alarm for you right from now. If you are on the lower side of the pointer, start working on that so that you become eligible to attempt NIPER at least. That was just some basic details about NIPER. Talking about GPAT again, I just would like to highlight cutoffs for a few years. Like if you take from the year 2013 to 2017, the cutoff of GPAT has been the range of 112 to 180. Not that alarming. You might be thinking that one side I told you that I want you to target all India rank 01, then why am I talking about cutoffs? So if at all things goes wrong during GPAT, you are ill or there are some problems and you haven't revised things, ensure that anyhow you qualify GPAT. Because if you don't qualify GPAT, you cannot write NIPER. तो जीपैट में कुछ भी रैंक है कुछ फर्क नहीं पड़ता क्वालिफाइंग जीपैट इज मोर इनफ सो दैट यू कैन राइट नाइपर इफ यू डोंट क्वालिफाई जीपैट राइटिंग नाइपर you won't be allowed. So if things are worst on the day of exam, ensure that you anyhow qualify at least, because then you have another 3-4 months to prepare for NIPER. GPAT is usually in the month of January, NIPER is in the month of June, July. You have that slot of 5 or 6 months in total maybe to prepare for everything in detail. Just observe this cutoffs. From 2017 to 2018, the cutoff is spiking by 21 marks. Again, 2019, it increased by 4 marks. Observe 2020, it increased by 22 marks. So, do we think the cutoff of GPAT are going to decrease any day? I don't think so. So, when it comes to 2021, I expect the cutoff might go around 180. 2022, I expect the cutoff might just shoot around 190, taking on an average an increase of 10 marks. Maybe 2023 around 200. So if I go to 2017, in 2017 the cutoff of GPAT I guess was around 112. My score was 151, my score, and my rank for GPAT was 484. If I might have got that same score of 151 in GPAT 2020, I might have been unqualified. कहने का मतलब ये है, glory of the past, things of the past won't help you in future. Your methodology, your studying techniques, the changing syllabi, the changing exam team, everything needs to be taken into consideration. From last 3 years, GPAT paper are being set by NTA, National Testing Agency. Earlier, it was AICT. So, moment the testing examination department is changing, you can expect things to alter a bit. Not that greatly, but yes, to some levels. So, we said we expect a cutoff of around 180 for GPAT 2021. So, if I'm expecting a cutoff around 180, I suppose we should at least get 50 questions in, which we'll be attempting. When we'll attempt 50 questions, let's assume out of those 50, maybe our 45 turn correct. 45 correct question would mean 45 into 4, a total score of 180. If you don't get even 45 questions correct, it's over. Nothing is going to help it. So this is only for those who are targeting just qualification. Just qualify ho jao kaise to. Although I want to remove that mentality, but you never know what would be the last situation on the day. Now let's talk about some rankers in. So these are just few random rankers of GPAT 2020. And if you observe, All India rank 01 in GPAT 2020 had a score of 315. Now, what is it? What I want to highlight over here is we all think that क्यों additional risk ले negative marking जाएगा मिल के क्या एक दो marks बढ़ेगा. Every single mark can make a difference of around 15 to 20 ranks. Don't think that एक mark से कुछ फर्क नहीं पड़ेगा. It can make a big difference. I'll show you how. Till the time you are in top 100 ranks, nothing is a challenge. Observe carefully. Between All India rank 1 to All India rank 8, there is a difference of 7 ranks and there is a difference of 22 marks. On the other side, when you go from All India rank 8 to All India rank 13, there is a difference of 5 ranks and there is a difference of 18 marks. So you might be wondering, अभी तो धर्मेश ने बोला कि एक मार्क्स से 15-20 रैंक का फर्क पड़ता है, इधर तो कुछ भी नहीं है. Observe things which are after 100. Till the time you are in the top 100, it's not a challenge. उसके आगे का if you observe, there is a difference of 172 ranks between these two candidates. Observe their mark difference. सिर्फ 13 मार्क का फर्क है. Within a difference of 13 marks, their ranks have differed by 172. While it was a difference of 18 marks over here, still the ranks were differing only by 5. So yes, every single mark can make a great impact. That's the reason I advise you to take a risk. Take that additional chance which can help you to turn it around. So say suppose if you're targeting only qualification in GPAT, 50 looks a good number to go ahead to get through. But if you want to be in top 10, I ensure you that if you attempt 100 questions, if you practice papers solving 100 questions each time, you will be getting through. Target 90 questions correct. 90 correct questions would mean 90 into 4, 360. So 360 आपका positive score होगा. Let's assume out of those 10 questions, 100 questions, your 10 questions go wrong. For every wrong answer, you will lose 10 into minus 1, minus 10. So 360 was your positive score, minus 10 was your negative score. 360 minus 10 will bring you to a net score of 350, which will for sure be in top 10 ranks in GPAT. Now this is what you need to do on day one. Goal setting. कितने questions attempt करोगे, कैसे करोगे, which questions will keep on focus, which is your strong area. You need to analyze these things. Blindly कोई भी book उठा के things are not going to work out. So be calculative right from day one how you're going to move across with different subjects and different topics. Talking about GPAT and NIPER, basically they both are different. Their method of preparation needs to be different, as we always say. With regards to GPAT, you have 125 questions, but with regards to NIPER, you have 200 questions. Observe the difference. 75 questions more in NIPER compared to GPAT. Now you might be thinking 75 questions extra है तो शायद time भी extra मिलेगा. ऐसा केस नहीं है बॉस. In GPAT, for 125 questions, you have 3 hours. But in NIPER, जहाँ पे 75 questions ज़्यादा है compared to GPAT, time बढ़ने के बदले time कम हो गया है. What you are going to get is only 2 hours. Here is the crunch. यहाँ पे टाइम की कुछ कमी नहीं है, यहाँ पे टाइम की कमी ही कमी है. Now it's you who have to deal in smartly over here. Don't worry, everything is possible. I myself solved my 200 questions in 1 hour 15 minutes. It's all about practice. How much you know so that you can speed up. Talking about GPAT, it has negative marking. In case of GPAT, biggest problem is this. You should know from where superficial questions are being asked. Like we are being said 4 साल का GPAT का syllabus होता है. I agree. I don't deny. I'm not saying that 4 साल का syllabus नहीं होता है. But then things are specific in some subjects where things will be asked in detail. Like you take example of pharmacology. You can expect pharmacology से detailed question रहेंगे. But if you are studying pharmaceutical engineering and if you have invested 5 to 7 days just to study pharmaceutical engineering or a subject like clinical pharmacy जिसमें से ज़्यादा questions नहीं होते for GPAT, in that case you have invested your time not in an appropriate manner. So you need to take into account the subjects which would have a vast importance. You should get an idea about different topics which are important and which needs to be focused. Now, how do you find out what questions are difficult, what questions are tough? You will be getting that idea as well. I'll showcasing that which subjects are more important. Going further, in case of NIPER, you also have negative marking just the way you have for GPAT. But when it comes to NIPER, in NIPER you have a lot of basic and application type questions as well. Now this is the place where you can increase your speed. Moment those are basics and application type questions is the area where you are supposed to go fast so that you can cover a good number of questions in a less time and later on you can spare time on difficult questions. Going further, how NIPER differs is NIPER also has a lot of general knowledge based questions, which is not the case with GPAT. GPAT में general knowledge based questions नहीं होते compared to NIPER. So those general knowledge based questions can be questions on your COVID. So this year NIPER had questions on COVID. This year NIPER had a question on hydroxychloroquine as well. I hope we all remember that was the first drug we said was effective. In NIPER, there are also a lot of intelligence quotient based questions. Simple reason why they have intelligence quotient based question is NIPER has a common entrance for MS. Yes, NIPER offers you a MS degree just as you get a MS degree from abroad. NIPER is the only institute in India which can give you a MS degree. Nextly, NIPER also offers you M.Pharm degree for some courses. NIPER also offers you M.Tech degree for some courses. So course to course they're different, but for most of the courses they have a MS degree. Not only this, the entrance for NIPER stays common even if you are going for pharma MBA. Yes, even if you are going for pharmaceutical MBA, pharma MBA. I know many of you are still in dilemma whether core MBA or pharma MBA. Don't worry, after next half an hour, you probably will be able to conclude on this. I'm not saying which side it will be totally based on your personal interest, but you will be getting a thorough answer that, okay, this is what I want ahead. So let it be MS, MPharm, MTech, or Pharma MBA, NIPER has a common entrance. So out of those 200 questions, around 25 questions will be MBA type. It can be simple intelligence quotient based questions, what we did in our 7 standard scholarship, 5, 8, 11, what would be the next number? ये वो questions है where we are supposed to go fast. What do you expect as the answer over here? It's just a difference of 3 constant. 5 के बाद 8, 3 का difference, 8 के बाद 3 का difference, 11, 11 के बाद 3 का difference, 14. Now you might be wondering इतने easy question आते हैं क्या? आते हैं. ये easy question are for you so that you can increase your speed in such questions and go ahead more fast. Going further, yes, there will be few questions on synonyms, antonyms, meanings, opposites पे questions रहेंगे. That is to check your vocabs when it comes to Pharma MBA. Again, in case of NIPER also, just the way you have some specific subjects and topics, it should be dealt in depth for GPAT, same way it should be dealt in depth for NIPER as well. Both goes hand in hand. Now, what differs majorly when it comes to NIPER is you need to be fast because the time is a big constraint over here, which is not the case with NIPER. Going further with regards to NIPER, as I said, you need to speed up. The more you practice, the more you read, the more knowledge base you will have. Once your knowledge base is strong on technical grounds, your speed will increase on its own. But all this thing is the secondary thing which will be a output of your effort. The primary thing which is going to be important for all of you is to understand knowing what is to be studied and how to study. You know you are supposed to study pharmacognosy, but you should know how to go about pharmacognosy. No one is going to ask you to write a short note on method of cultivation in pharmacognosy. No one is going to ask you to write metabolism for drugs in GPAT. Yes, you should know which drugs are pro drugs. which drug is the active moiety, which metabolite is the active moiety. But no one is going to ask you to write the structures. So the methodology of studying, as I've been emphasizing on to, is the most important factor so that you don't go in the wrong direction. Going further, talking about NIPER institutes across India, there are seven in number. NIPER Mohali, the first one, followed by NIPER Hyderabad, NIPER Ahmedabad, NIPER Raebareli, NIPER Guwahati, NIPER Hajipur, and NIPER Kolkata. So every NIPER has its own pros and cons, but the best one, preferable one, would be this three, based on the industry exposure, learning, packages, return on investment. Because when it comes to NIPER, your post graduation fees are hardly 1.5 lakhs for 2 years. Yes, 1.5 lakhs for 2 years. And your stipend is almost 3 lakhs. So you're always starting on a increased note. At the same time, industry exposure is also too much. You get a lot of industry lectures and different experiments, sponsored projects as well. Going further, talking about strategies for GPAT preparation, there are few questions which should be on priority for you to think upon right from now. So I'll be focusing upon those questions as well. Most important, anything when it comes to any goal setting is you should have a planning in hand. Without planning, if you haphazardly simply pick up any book, दोस्त ने बोल दिया पियर्सन पर जीपैट हो जाएगा, it won't help. आज पियर्सन ले लिया, कल के डे त्रिपाठी, थर्ड डे ब्लैकमैन, that's not the way further to get things done. Most is going to stand most important is planning in the right direction. If you plan things in the right direction, I don't see it as a challenge. Construction site workers work more hard than us. No offense on that. But are they making more than us? No. Probably it's just a random way to go about. I don't want you to go in a random way. Get yourself cleared that what is it you want to do 5 years down the line from now. That should be your focused area. 5 साल बाद आपको क्या करना है, that's going to be more important for you. Going further, talking about the few important questions which needs to be answered if you are planning to prepare for GPAT is what to study. 4 साल का syllabus सबने बोल के रखा है, but is it the case? Do we really need to focus entirely on those 4 years syllabus? The answer is no. There are few specific things which you need to focus more upon, and there are few specific things which you can do superficially. I'll be talking upon that on the next slides. Next important thing is how much to study. पढ़ना तो है. You have been said that rheology से question आते हैं, but rheology से are you ever been going to ask to write a short note on plastic flow or pseudoplastic flow? No. Rheology से हमेशा question यही आया है on the basis of example. Paste shows what type of flow, suspension shows what type of flow, colloidal solution shows what type of flow. So when I'm studying rheology, smartly I'll focus only on examples. I'm not bothered about those big short notes. I hope you're getting a clarity about how to prepare it. Most importantly, from where to study. Now this is the most important factor. Like if I take example of NMR, when I studied at NMR, I referred to one of the Indian author books. I'm not saying Indian author books are bad. They are the best when it comes to basics. Basic understanding and learning is the best explained in Indian author books. But I found those were incomplete. Because when I was studying that same NMR during my post graduation, there were a lot of things जिसके बारे में मैंने कभी सुना ही नहीं था. There were few questions in my NIPER paper itself which I was not able to answer. It was on coupling constants being revolved around and just twisted for systrons. I was not able to answer that. And later on, I realized that those things were given properly and in detail from the book Pavya. Pavya, very few of us ever knew in our GPAT. So that's where we go wrong. We feel that chapter हो गया, मैंने पूरा NMR पढ़ लिया, NMR से कुछ भी question आएगा, I'll be able to answer that. But fact of the matter is that we are way beyond that because we were referring to the wrong book. So we are under the illusion that okay, I know things. There is not a challenge. But fact of the matter is that we don't know things. We are still stuck. Most importantly, having a deadline in front of your entire plan will be the day one of your planning. By when are you going to finish it? So if you are a GPAT 2021 student, you haven't got your exam dates till now. Most of the time it used to be in January end. Let's suppose it's going to Feb mid. Let's suppose. I'm not saying that it has shifted, but let's suppose it has gone to Feb of 2021. Now the most important thing again over here, you have your semesters coming up and most of you have it in December. And we are already in November end. So I don't see you focusing for GPAT till the time you're done with your semesters, maybe in December end. So next 2 months you will be focusing, 40 days, only on your semesters. So what you should do is when you're preparing for Sem 7, while studying for Sem 7, whatever subjects topics you have, study those subjects from GPAT point of view as well. Study those subjects in detail right from now so that your GPAT as well as your semester 7 gets through. Because any which ways in your semester 7 you have exam of MCQs to a good extent. So both the things will get ready. Once your semesters are done, you have entire month of January. Now you will be having only that 1 month. And if you are someone who has just started preparing, then you need to smartly take a call that in January, what will you keep in focus? Because to be honest, I want you to target NIPER only. I want you to reach out to NIPER, Mohali, Hyderabad, Ahmedabad. Best learning, best exposure. But for that, GPAT qualification is must. Unless and until you qualify GPAT, you cannot get through for NIPER. Keep that primary thing into mind. Going further, this is just previous year paper analysis for GPAT. So if you observe closely over here, this is analysis from GPAT 2016 to GPAT 2020. We have taken into account different subjects. So when I say chemistry, I mean everything: organic chemistry, pharmaceutical chemistry, medicinal chemistry, physical chemistry, everything. Also, you have pharmacology APP, pharmacognosy IPR, and various other subjects. Just observe, most of us have either a challenge in chemistry or a challenge in pharmacology. And we tend to leave either one of the subject in options, or we tend to leave both the subjects in options. So if you are someone who is going to leave both the subjects in options, you are destroyed, boss. Qualify तो हो जाओगे, but forget a better rank. Let's observe for the year 2019. From 2018, NTA came into the picture. Since last 3 years, it is National Testing Agency who is being setting up the GPAT paper. 28 questions were from different chemistry, plus, I mean 20 plus 8, 28. 32 plus 3, another 35 questions were again from different chapters of pharmacology in APP, semester 1 and 2, anatomy, pathology, pathophysiology. In total, 28 plus 35, you had 63 questions, which were only from these two subjects. 63 questions out of 125 questions basically mean that 50% of your GPAT paper was only from these two subjects. आपने कुछ नहीं पढ़ा होता, बट अगर ये दो सब्जेक्ट्स भी डेप्थ में पढ़े होते, आपको 50% करेक्ट क्वेश्चंस इजीली मिल जाते. So this is how calculative you should be. If you are someone who is interested more in biochemistry, not a problem. Read biochemistry, but keep it at the last on the preference. If you love reading pharmaceutical engineering, P for pharmaceutical engineering, not a problem, but don't pick up initially. There are only a few number of questions which are being asked from this. Keep it at the end. Start with pharmaceutics on the first go. Pharmaceutics is having a good number of questions. Same way for your pharmacognosy, the number of questions are increasing 10, 13. So are you going to study method of cultivation? The answer is no. You will study microscopy, you will study BSCC, you might study any specific cues. That's how you're supposed to structure it. Don't focus on subjects and topics initially which don't have a good number of questions coming up. You can apply such technique to all the competitive exams you're planning to write. Even if you're planning to write CAT, even if you're planning to write Maharashtra CET or anything, make it into such a chart. Get a clarity कौन से subject. In fact, you can make it more vast. कौन से subject की कौन से chapter से question आया. If you go to that greater depth, you will get a much better idea that which subject, which chapter is supposed to be focused upon as well. Going further, talking about different strategies to be followed. With regards to strategies to be followed, we talked about studying and preparation strategy. Talking about practicing with regards to test series. Now, we have always been asked a question that when it comes to practicing test papers, should we do it offline from some book or should we do it online? I always advise that test series should be practiced online. Why? Because there are many things you will never get through as an experience in your offline. You might say paper offline solve kiya, so I'll come to know timer. I can use a stopwatch. Online not only offers you a stopwatch, but it offers you the feature of mark for review and next, which is also known as flagging. Now, what do you mean by mark for review and next? What do you mean by flagging? I'll talk about it in next 2 minutes. Problem is that when we practice it from book. We basically don't know that flagging किए हुए questions, mark for review किए हुए questions को अगर आप unmark नहीं करते हो, then does it get submitted for analysis? Does the marks are being counted? We are unaware about such all things because we haven't done it in that way. There are different ways of solving test papers as well. So let's assume you have 15 full length tests to be prepared. Solve this 15 full length test in different bars. First solve 1 to 5 full length papers. In each of the full length paper, make it a practice to solve 100 questions anyhow. कुछ फर्क नहीं पड़ता आपको नहीं आता है तो भी any which ways you are just practicing. Even if you go wrong, it's not a challenge. Suppose you attempt 100 questions. Out of this 60 questions go correct, 40 questions go wrong. अब ये 40 questions wrong गए. Out of 125 you just attempted 100 questions. So 25 questions were unattempted. This 25 questions and this 40 questions where you have gone wrong. 25 plus 40, this 65 questions. Read about this 65 questions. When I say read about this 65 questions, I don't mean just reading their answers. I basically mean go to the reference book. So if you are going wrong on answer of start codon, you should know everything about codons. ऐसा नहीं होना चाहिए then you only know examples of start codon. You should know also what are the examples of stop codon. You should know verbal hypothesis. You should be through with each and every topic where you had gone wrong. Then attempt paper number 6 to 10. Again, make it a habit to solve 100 questions. You know, mindset is everything. एक बार ये दिमाग को आदत लग गई ना कि हर पेपर में 100 क्वेश्चन अटेम्प्ट करना है. Trust me, in every paper, you yourself will go to around 100 questions. On the day of GPAT, you might just filter around plus minus 10 questions. So if you attempt, say, 100 questions again, now your focus should be to make 80 questions correct. 80 going correct, 20 going wrong. Again, find out ये 20 कहाँ के wrong जा रहे हैं, which subjects they belong to. Again, you have not attempted another 25 questions. Read about this 20 plus 25, 45 questions. Then go to paper number 11 to 15. And then in this paper number 11 to 15, target attempting 100 questions, out of which anyways you should get 90 correct. What it does is, wherever you have gone wrong in the previous 10 papers, it has helped you to identify your weak areas. Once you know that where are you going weak, and if you read that, you will be more than strong next time a question comes from that part. So just don't solve papers for the sake of solving. Identify where are you going wrong with subject, which topics as well. Going further, as I said, mindset is everything. Make it a habit to solve 100 questions. On the day of GPAT, you yourself will attempt 100 questions. Again, there are different ways of solving MCQs. One way is marking the correct answers when you are sure. तो अगर आपको पता है आंसर क्या आपने उसको मार्क कर दिया, इट्स डन. Next method is elimination method. You can apply these things to different entrances as well. Elimination method basically means that you don't know what is the correct answer, but you know one thing for sure, that C and D are not the answer. मतलब आंसर A या B में है. Lastly, talking about logical way of solving. Suppose you are being asked to calculate child dose for a drug whose adult dose is 350 mg. Sorry, 650 mg. एडल्ट डोज 650 mg है, चाइल्ड डोज कैलकुलेट करने बोला है अकॉर्डिंग टू यंग्स फॉर्मूला. अब यंग्स फॉर्मूला पढ़ के मेरे को 4 साल हो गए, मैंने यंग्स फॉर्मूला रिवाइज भी नहीं किया. आई डोंट नो द आंसर. मोस्ट ऑफ यू माइट लीव इट. जिसको भी फॉर्मूला पता नहीं होगा वो शायद अटेम्प्ट ही नहीं करेगा. बट देन देयर विल बी समवन स्मार्ट हु विल ऑब्जर्व ऑल द ऑप्शन एंड ही नोज जस्ट वन लॉजिक, दैट चाइल्ड डोज इज ऑलवेज लेस देन एडल्ट डोज. एंड देन इफ यू ऑब्जर्व ऑल द ऑप्शन, 4 ऑप्शन में से सिर्फ एक ही ऑप्शन ऐसा है जिसका वैल्यू 650 से कम है, which basically means it is the answer. There is no need of Young's formula. There is no need of any calculations. This is how logical system works. And yes, in GPAT you will get such questions where you can apply them in. Talking about practicing pattern, I was telling you about mark for review and next. So when you mark for review and next the question gets highlighted. ये पूरा question palette है, इसमें वो purple हो जाएगा. It will get a different color. So what you can do later on is, once you are done with it, once you are done from question number 1 to entire 125, जो भी questions आपने mark करके रखे थे, those all will be available in purple. Straight away go and click on that particular purple one. Mark the answer. आंसर मार्क करने के बाद जो सब लोग गलती करते हैं, सब लोग डायरेक्टली नेक्स्ट पर्पल पे क्लिक करते हैं. नो, इफ यू डोंट क्लिक ऑन दिस सेव एंड नेक्स्ट, योर आंसर वोंट गेट सेव्ड. एंड दिस इज व्हाट हैपेंस. हमने ऑनलाइन प्रैक्टिस ही नहीं किया, हमने इधर क्लिक किया, फिर नेक्स्ट क्वेश्चन पे क्लिक किया और उसका आंसर मार्क किया. दैट्स वेयर यू गो रॉन्ग. Mark the answer, click on save and next, and then click on the next purple. Otherwise, your answer won't get submitted. This detailed video about this is already there on my channel. You can just type Dharmesh Mehta GPAT You'll get a better clarity on this. Nextly, with each paper which you are solving, identify what is the number of time you are taking on individual seconds. Your online system can help you assess that. You cannot do it on your offline systems. Even though my answer has gone correct over here, I took a longer time. Niper में 15 सेकंड एक क्वेश्चन पे won't help. So even though you have gone correct, but probably your concept is not that great strong over here. So you need to work more on this so that next time a question comes from this part, you will be fast enough to solve it. Most importantly, get a comparative idea about where are we standing. So if one paper you are solving and if one paper topper has solved, how much time has it taken? Based on its rank, how many correct questions did he get? How many wrong questions did he go? What was the total number of questions he attempted? Get an idea about all those things. When you compare it with your score, you will get an idea that how more we need to work in so that we can be on par. Most importantly, people will tell you about different reference books, different subjects, different topics, but no one ever talks about how to go in case of paper solving strategy. When it comes to paper solving strategy, 125 questions are for 3 hours in case of GPAT. Solve the paper in 3 rounds. I'll just tell you how you should go about. You can apply even this to any of your competitive exams as well. Let's suppose 125 क्वेश्चन में से 35 क्वेश्चन ऐसे हैं जिनके बारे में आपको ज़्यादा कुछ पता नहीं. So these are unknown questions and they should not be attempted. On the other hand, you have another 90 questions. Let's assume 90 questions में से 50 questions ऐसे हैं जिसके बारे में आपको पता है. This will be a part of your round one. राउंड वन में सिर्फ वही क्वेश्चन अटेम्प्ट करो जिसके बारे में यू आर श्योर. राउंड टू इज फॉर द क्वेश्चंस व्हिच यू हैड फ्लैग्ड, मार्क फॉर रिव्यू करके रखा था, जहाँ पे थोड़ा कैलकुलेटेड रिस्क है, 50-50 सिचुएशन ऑफ यू गोइंग राइट और रॉन्ग. And then finally you go ahead when you attempt this 40 questions, when you take a risk in this round 2, out of this 40 questions, if your 10 questions go correct, 10 correct and your 30 wrong. 30 questions wrong would mean 30 into minus 1, which is minus 30. And your 10 questions when correct, 10 into 4 is plus 40. Plus 40 minus 30 comes to a net score of plus 10 marks. A difference of 1 mark was leading to a difference of 15-20 ranks. A difference of 10 marks will for sure give you a difference of 100 to 150 ranks. That's how you should be calculative. So round 1 से वही attempt करो जिसके बारे में आप sure हो. Round 2 आपने जो जो question purple करके रखे, take a risk and attempt those. Round 3 is for this unknown question जिसके बारे में कभी कुछ सुना नहीं. But if you can find a logic, if you can find some connection, then probably you can take that risk as well. So this is just a overall ideology that how it can go in. So let's suppose you attempted 100 questions on the day of GPAT. This can be your entire journey when you will be practicing for GPAT papers. You might start at this level, but by the time GPAT comes, you should be at this level. 100 questions attempted, 90 going correct, 90 correct attempts, 90 into 4 will mean a net score of 360. 10 wrong answers, so 10 into minus 1 is minus 10. 360 minus 10 will bring you to a net score of 350, and the net score of 350 would basically mean that your rank will be in top 10. So this is how you need to plan things right from day one. Talking about few most important things which probably plays a good mental state in. Stop asking yourself whether I can crack GPAT. Think about what rank should you target. GPAT crack karna is not at all difficult if you have got through the entire flow what we just discussed. Think about what rank should you target. You know, there are different success stories of GPAT in the past where people didn't had great scores in their semesters, in their bachelors, not in 10th, not in 12th. Don't think what happened in NEET. Don't think what happened in JEE. Don't think that you couldn't get into MBBS and now you are into pharma. Those all things are of past. You cannot change anything in that. Nothing is editable again. But the ones which is coming forward, the GPAT exam which is coming ahead of you, is the place where you can do things. Is a place where you can turn around things. So focus on things which are in hand. I'm not saying that semester scores and semester marks doesn't make a difference. Because when you read for semesters, you equally get ready for your entrances. But when you do it for semesters, you focus more from theoretical aspect. Now with this exams happening online for your semester 7, I expect you will think also from MCQ's point of view for each topic which you will be reading. So think more of from application point of view. Don't think semester में score नहीं आया तो यहाँ कुछ नहीं कर सकता. सेमेस्टर में फार्माकोलॉजी के शॉर्ट नोट्स पढ़े लिखने पड़ते थे, ओसी में मैकेनिज्म लिखना पड़ता था, कौन किस पे कैसे अटैक कर रहा है, बट व्हेन इट कम्स टू जीपैट मैकेनिज्म नहीं लिखना। यू शुड जस्ट नो दैट वर्ड्स रिएक्शन में अल्केन का कार्बन नंबर डबल होता है, वो अल्केन के लिए यूज होता है। तो आपको चार ऑप्शन में से जो अल्केन दिखेगा वो ऑप्शन आंसर है। इट इज एज इजी एज इट कुड बी। नो वन इज आस्किंग यू टू ड्रॉ द एरो एंड शो एनायनिक cationic attack. So the way you are preparing for your semesters and the way GPAT preparation is required, they are two different domains. Don't confuse them. Don't think that if you couldn't do well in your semesters, you won't be able to do in GPAT. That's not the case. They are not two totally different entities, but yes, they are not totally overlapping as well. Anything and everything is possible, I suppose, but it's all about perception. So if you perceive in your mind that okay, you can do it, probably Vescop will have first time a single digit GPAT rank. We have had double digit, but yes, just believe in yourself to become, and probably we will be writing history soon for Vescopen, a first single digit rank for GPAT for Vescopen. Thank you so much for your time. Whatever questions, whatever queries you have, you can shoot in. You can reach out to me onto the given contact number and email ID as well. Just the initial thing what I was saying, where I need to keep a bit descriptive, maybe around the 5 minutes or so. Most of us are confused between three different domains. Like you may be focused about whether farm MBA, you may be focused about whether core MBA, you may be focused about MFARM, you may be confused about whether I'm supposed to go for MS abroad. So these are a few different domains which we all are being stuck into. MFAM हो या MTech हो, it's in India only. And when it comes to MS in India, MS का degree सिर्फ NIPER देता है. Most of us are unaware about it. So if you want that MS degree, you have NIPER in place, or you can go abroad. There are two different stages being involved over here. Now let's get a clarity onto this major confusion. I'm not going to conclude anything. The conclusion will be customized. Each one of you will have a different interest. Each one of you will have a different go ahead. Let's get an idea about what should be your go on the comparative basis. It has been around 2.5 years in industry, so I've observed few people who have changed their streams in. Let's get an idea if that happens with you. It doesn't mean you will fail like them. It will depend on your interest. So nowhere this can be concluded generally. It has to be your personal call depending on your interest. पहले ये सोचते कि एमबीए करना है या एमकॉम करना, टेक्निकल में जाना है और आई वांट टू गो ऑन द मैनेजमेंट साइड. So let's think on this aspect from the interest point of view, not as of now from salary or the money point of view. Because at the end survival की बात है, we all need money. The last bucket is that only. So अगर इंटरेस्ट एरिया में बात करते हैं, if you are someone who is interested in technical backgrounds, technical grounds, experimentation, lab work, then this is the domain for you. यू आर नॉट मेड फॉर दिस. ऐसा नहीं बोल रहा हूँ कि आप ये कर नहीं सकते हो, आप ये भी कर सकते हो, बट प्रोबेबली इफ योर इंटरेस्ट इज मोर ओवर देयर, देन दिस इज योर एक्सपर्टीज. You should go with this. And then if you think about return on investment, MFAM grads are not paid well in India. There is no research in India. Ask someone who has been from here. He'll tell you what is the scenario. So referring the right mentor is more important. Talking about MBA, pharma MBA and core MBA. Now most of us again get stuck over here. MBA to karna hai. Now the reason to go for MBA is not always that they are interested in MBA, but the interest lies that they are not interested in technical ground. They are no more interested in how the drug acts and all, how the drug tablet is being developed. And since they don't have option of doing technical grounds, they go for management side. One of the reason, and vice versa. जिसको management में interest नहीं होता है, उनको डर लगता है भाई sales ही होता है. That's not the case. Pharma MBA and core MBA is not only about sales. You can get into different domains. Business analyst is booming. There are various areas which you can focus upon. It's not the case that it's only one place where you will land up after doing an MBA. No, you have business analytics, you have product management, you have different domains like project management. At the same time, sales is just one of the aspects, and we all fear that. And that's the reason we try to avoid MBA. Now, talking about the case of MBA, we get confused whether to go for pharma MBA or core MBA. Now, again, this is a personal call. It cannot be customized over here as well. When I made one video 2.5 years back, which is on my YouTube channel, In that video, I concluded saying that pharma MBA would be more optimal based on our background of pharma. But today, when you ask me, I would say it is totally dependent on interest. It's not the case that you should go for pharma MBA only or you should go for core MBA only. It's on your interest. Someone else went for a core MBA and is doing well now in his or her career doesn't mean even you will be able to do that, because probably it might not be your interest area. So stage one is to identify where does your interest lie and then think on the next grounds. Now what most of us think is अगर मैं farm MBA करता हूँ then I'm restricted only to pharma industry. And if I do core MBA, I can get into pharma industry. I can also get into automobiles. I can also get into technology. I can also get into Xiaomi and all the different tech backgrounds as well. Agreed. I don't deny that. But if you do a core MBA and after doing core MBA, if you're planning to get into a pharma company for job, it's not the case that it's impossible. But if a company is having option to choose between a pharma MBA, I mean a pharma company is having an option to choose between a pharma candidate and a core MBA candidate, most of them will go for a candidate from pharma MBA background. Not the case that core MBA को chance नहीं मिलता. It totally depends on how the interview goes. But most of the time they'll prefer a pharma MBA guy because उनको वो चीज़ ही चाहिए. Pharma को लेके ही वो चलेंगे. And they have that technical background for a more better expertise. But if you are doing core MBA after BPharm, the first question comes is core MBA you could have done after your BSc BCom as well. Then why did you choose to do BPharm and then core MBA? बहुत लोग ऐसा बोलते हैं. I don't think that is a question. आपको बी फार्म के बाद रियलाइज हुआ दैट योर मोर इंटरेस्ट इज ड्रिवन टुवर्ड्स दैट, सो इट्स टोटली फाइन. डोंट गो ऑन द वर्ड ऑफ द वर्ल्ड दैट बी फार्म के बाद अगर कोर एमबीए करना था तो बीएससी या बीकॉम ही कर लेता. नॉट द केस. डोंट फोकस ऑन दोज वर्ड्स. इफ यू आर नॉट इंटरेस्टेड मोर इन फार्मा, go for a core MBA. You might have to switch over to a different industry. So I know few of my colleagues who did core MBA, then they were into automobiles. अब ऑटोमोबाइल्स का उसको बैकग्राउंड तो कुछ भी नहीं पता था. So managing things over there were getting difficult because she had no tech background. At the end, after 2 years of job work, some or the other way, she came back to a pharma company after doing core MBA. She had a core MBA, but at the end, she came back to a pharma company only. Now the problem over here was she was interested for a job in pharma company only. She was interested to pursue her career in pharma only. Then there was no need of core MBA. So be clear that 3 years down the line, 5 years down the line, where do you see yourself? Now let's suppose you're doing pharma MBA. Now you might just think that pharma MBA करने के बाद I'll be restricting myself to pharma industry only. Totally agreed. Most of the time, a yes. But yes, restricting to a pharma industry doesn't mean that you will be only in sales, as I told you. Business analytics is one of the booming industry. I don't know, many of you might not be aware. There are different grads, postgrads who are into business analytics. They have a engineering background. They have a BSc background. उनका फार्मा बैकग्राउंड नहीं है तो उनको फार्मा टर्म्स पे ट्रेन करना पड़ता है. But if we are from pharma background and if we are targeting to get into domain of business analytics, there are few softwares for which basic understanding is required. वो इंडस्ट्री खुद ट्रेन करती है. If you have a prior training, then it's more better for them. Otherwise, they are more than happy to train on their particular softwares what they are using. So there, a business analytics guy who is from a pharma background is more preferred. And all the pharma companies are hiring them, right from Novo Nordisk based at Bangalore to Novartis to Cipla in Mumbai. They all have this domain because it's the business analytics domain which is going to drive the business. They are going to be the key decision makers to tell them that what is required, how is the business switching over, whether it is compatible or not. So after doing pharma MBA, you can get into business analytics domain as well, जहाँ पे अभी engineering crowd बैठा है, because engineering crowd को वो softwares आता है. We don't know that and we are not ready to learn new. We are okay to do sales, but we are not ready to get another skill set. That's the challenge. So if you are someone who doesn't love pharma anymore, only then you go to core MBA. कोर एमबीए में घुसने के बाद फार्मा कंपनी टारगेट करोगे तो आई डोंट थिंक टेकिंग अ कॉल ऑन कोर एमबीए वाज एनी डे प्रेफरेबल. And if you are doing pharma MBA, the number of pharma industries are many. Now even people from healthcare background are getting into pharma industries. So if you check their background, they are having dental, BDS and सब होता है. फिर they go for an MBA in healthcare management from institutes like this, Tata Institute of Social Sciences. They have their own entrance. There it is also very much affordable. Like the amount is negligible compared to where we start with packages. Even that's a preferred one. But yes, they are a challenge to pharma crowd, a pharma MBA crowd. So if other domains are getting into our area, then where do we think that we don't have money? Talking about M.Pharm and MS from the tech background point of view, like if you are someone who is confused that मेरा technical भी अच्छा है and मेरा MBA point of view skill और interest भी अच्छा है, then probably your and my case is same. So if you do M.Pharm or MS from India, as of now I'm taking first example from India. So suppose if you are doing it from NIPER, let's take that example in case of doing M.Pharm or MS from India, do you think it's the case that you will only work in R&D? The answer is a big no. It's not the case that you only work in research and development. Point number one. I'm just removing some myths. You can get into regulatory affairs, you can get into IPR, you can get into pharmacovigilance, you can get into QA. There are a lot of different departments you can get into. Nextly, heard of supply chain management, SCM, the next booming industry. So even if you don't have an MBA, you can still get into supply chain management. कैसे सर कौन हायर करेगा? Just check 1.5 years back, Novartis had hired from Bombay College of Pharmacy for supply chain management. They took up candidates who had M.Pharm in medicinal chemistry and all those different backgrounds. So ऐसा नहीं है that आप M.Pharm करके दूसरे backgrounds में switch नहीं कर सकते हो. What about Sun Pharma? Sun Pharma specially recruits M.Pharm in pharmacology candidates for marketing. Why does it do that? M.Pharm in pharmacology ही क्यों prefer करता हो? Simple reason being, if you have a M.Pharm in pharmacology candidate, they know the drug to a greater extent, the human physiology to a greater extent. And when it comes to business development, sales, or a marketing pitch to a doctor, you need to talk with doctor on pharmacology grounds. उसको समझाना पड़ेगा कि मेरे ड्रग में ऐसा क्या सुपीरियर है या मेरे टैबलेट में ऐसा क्या सुपीरियर है. So they prefer M.Pharm in pharmacology, not only in sales but BD and marketing planning as well. So it's not the case that after doing M.Pharm you cannot get into marketing domains. Next, more important thing, after doing M.Pharm, if you get into R&D, from R&D you can any day pursue MBA, maybe a distance MBA, not a full-time MBA, part-time MBA. Wellington offers it, NMIMS offers it. So you have a tech background and now you have MBA. आपके पास दोनों चीज है. So in that case, you will be preferred over others because you will be having a technical background with the management skill as well. So from any day from M.Pharm you can switch to MBA, but after doing M.Pharm you can never come back to after doing MBA you can never come back to M.Pharm. So be clear on stage one that boss अपने को क्या करना, because that is where the entire interest will lie. And talking about M.Pharm, MS, what is the difference? Not as such great difference. It's only with regards to the learning experience which would be differing greatly at both the ends. Syllabus थोड़ा अलग है. We'll get a lot of practical industry learning. And yes, the return on investment is a good focus. Where you might be spending around 4 lakhs for 2 years over here, you might just spend around 1.5 lakhs over here. And your salaries, your stipend accounts to 3 lakhs on both the sides of the picture. Packages right from 3.5 minimum to 9. In fact, 3.5 I suppose would be with NIPER Ahmedabad. 9 is with NIPER Mohali. GSK offers it, GlaxoSmithKline, that too in supply chain management, irrespective of whether it is MS in pharmaceutics or it's an MBA candidate. So forget the myth that there is no money in India if you do MS or you do M.Pharm. पैसा सब जगह है, पैसा MBA में भी है, इसमें भी है. It all depends on what is your skill set. Someone might fit in any domain because they have the knowledge and they are able to groom themselves. But on the other hand, someone might just be stuck at one point and might not be ready to switch over. So it depends on what skill set we have, how much we are ready to update ourselves. The more we upgrade ourselves, the more we are ready for industry standards, and the more better it would be for us. Thank you so much. I hope it was worth your time.
Thank you. Thank you, sir, for your wonderful session. Now moving towards question answer session. So we have question: what if we qualify GPAT and does not do well in NIPER? So what are the best colleges or options we have? What should be the backup plan and other university exams?
So Ashok, basically, if you qualify GPAT and doesn't do well in NIPER, Ashok, can you, sorry, Omkar, can you just mute yourself? I suppose the echo is coming from your side. The voice
Okay,
is getting echo.
so
Yeah, thank you. So basically, what I was meaning to say is when you don't do well in NIPER, the factor is not about how well you don't do in NIPER. Let's assume that you're not able to get into NIPER Mohali, Hyderabad, Ahmedabad. You're missing onto the top three. In that case, the backup plans for you should be one of the entrance, which is ICT MTech. You can get into ICT. Very few people are aware about ICT's MTech entrance. The number of students attempting it are less. When you get a tech degree, it doesn't mean that you cannot get into R&D or something. Tech doesn't mean it's engineering. It's formulation and pharmacy only. So I suppose Westcop student only. Your senior batch, she was ICT MTech rank 2 this year. So she has joined there for MTech. Prior that also, two of your super seniors are a part of ICT MTech. This can be a backup plan where if you are GPAT qualified or unqualified, you are eligible to write the exam. So even if you are GPAT unqualified, you can write this exam. But over here also there is a criteria of pointer, same 6.75. उससे ऊपर pointer चाहिए or else you can't write. Here also advantages would stay the same, right from return on investment to the level of industry exposure. Only challenge over here you might face is with regards to the placements. It's not that case that कुछ placements होते ही नहीं है, but comparatively it's on a lower scale. But I suppose based on your networking, based on your efforts, you can totally turn it around. I totally feel that your network is your net worth. So if you have a connection around, I myself got placed through via one of the people I knew, even being a part of Niper Hyderabad. I didn't get placed via campus placements because they didn't had companies coming up from Mumbai. So I wanted a company from Mumbai for Mumbai. So I could do it from my side. Same way, it is you who need to develop network right from now. It's not about expecting a favor in the long run, but it's about learning from those industry experts, understanding from their experience that where they have gone wrong so that you don't repeat those same mistakes. And if you talk about a backup plan after ICT MTech, I suggest you keep attempting Manipal as well as FITS. Although they have a higher side of the FITS to start with, but the return on investment is accordingly that over there, especially if you're targeting a non-tech background further, if you're targeting regulatory affairs, IPR or something of that sort, you can go into that way as well. I hope I could answer your doubt.
so there is a next question. Which is the better option between research and development and quality insurance?
Between research and development and, can you just repeat?
Quality insurance.
So when it comes to R&D and QA, the difference majorly lies with regards to what you are interested, whether it is the product development. So when you're working in formulation, research and development, you will be involved in developing the product and all those things. When it comes to quality assurance is majorly dealing to a good extent with documentation, audits and all those things. It's not the case that it's not a good field. In fact, it lies to a very good extent. If your plants are not GMP approved or if they are not in the required norms, there would be no production. That's where some giant companies have already gone down. Everything was in place, but their QA systems were not fine, and their plants failed audit by audit from different regulatory agencies. Now, the advantage or the disadvantage based on the way you perceive it, most of the time when it comes to QA QC, you will find your colleagues, your superior who are majorly from BSc backgrounds. It can be BSc from any streams. So, coming from a hardcore pharma background, if you are interested in QA, only then I advise you to go for it. Or else, I suppose formulation and development will always be a great option to start your career with. I was being advised to start my career with formulation and development hardcorely. And the reason I was being said that was, if you start your career with R&D, if you start your career with formulation and development, anytime you can go to QA, anytime you can go to regulatory, anytime you can go to IPR, anytime you can go to pharmacovigilance, anytime you can go to project management. So you have a lot of options open when you start from formulation and development as a career choice. Because most of us get saturated in our job role doing the same thing years after years. But if you have a clarity that, boss, I'm not interested in this, I'm not interested in either of this, what I want to get into is purely business development, and that's what I'm perceiving myself to see in the long run. So I had this goal clear that मेरे को long run में क्या चाहिए था. I was not hovering around कि भाई पहले इससे start करूँ फिर इससे इसमें जाऊँ. So if you are someone who has interest in multiple fields, then you can probably start with R&D to start after 1.5 2 years gap. Like, I know my seniors who are with different MNCs. Those MNCs have they give you internal job openings and switch over. So from after 2 years, she will be shifted from formulation and development to regulatory affairs in the same company. After 2 years, after regulatory affairs, she will be placed into tech transfer based on her choices. She can alter in three different departments in 3 years, 6 years, 2 years in each department. So based on your interest, you can actually plan to turn around accordingly.
Thank you, sir. There is a next question. Is pharma MBA is valued on same basis with core MBA in pharma company?
As per as my understanding goes, like, I'm not from pharma MBA background or core MBA background, but what I've heard about and what I've seen my batchmates, it's not that greatly different. What difference you bring in the store is not the degree. It's actually how you express yourself on the day. So even if you don't have an MBA background, there will be resistance. HRs might not allow you for the interview, but if you have that perception of observing things the way an MBA candidate does, you will be preferred even if you don't have an MBA degree. So degree, I feel, is sometimes the door opener to get to that interview stage. Once you get that interview stage, whether it is core or pharma, doesn't matter. So if you have a strong pharma background of bachelor's, and then if you did core MBA, something what a pharma MBA candidate might have read, you have already read strongly in your B Pharm. So even if the company says we want a pharma MBA candidate, they might have read multiple tech backgrounds as well. It's you who have to defend it, saying that what they studied in postgrad, I've already done in my graduation. So it doesn't matter when it comes to knowledge level, we both are on the same page. It's your confidence which is supposed to outgrow and break through everything around. If you are confident on your stake, what you are saying it, I don't think it will be a challenge whether you come from pharma or core. Only thing is that reaching to that interviewing stage might be difficult, because if there is a pharma MBA candidate and if there is a core MBA candidate, if you're not being given a chance to speak, and if on the basis of resume they have shortlisted, which actually happens with some companies, then you probably might just lose a chance. But I know few companies in cannot name it on this platform. So they had two candidates. One candidate was MS from NIPER, Hyderabad, and there was another candidate who was Pharma MBA again from NIPER, Hyderabad. So both the candidates were from NIPER, Hyderabad only. Went to the same company for the interview. That guy was a Pharma MBA candidate, but he lacked the tech background. Technical skills nahi tha, even though he did it in B Farm, probably couldn't recollect it. But this guy who came from a technical background had the nudge of convincing. Required skill set of convincing was there with him. Technical background was already there because he was a MS candidate. He could convince it, and although that job opening was saying that they need a pharma MBA candidate, it was not the pharma MBA candidate which was hired, but it was the MS candidate which was hired. So I suppose it might just make a difference getting onto the door for personal interview, but not that great ahead.
Thank you, sir. That's for all question we had. Now moving towards the end of the session. So it's my take on behalf of VS of College of Pharmacy. I would like to thank our special speaker, Mr. Dharmesh Mehta, for exhaustive elaboration on various aspects of competitive exam, helping the participant to plan their studies for various competitive exams. Further, I take this opportunity to thank our organizing committee, ICT support, my fellow coordinators for their support and coordination for this event. Last but not least, I would thank our special audience for their overwhelming responses. Thank you all.
Thank you so much, entire team. Thank you so much, Anita ma'am, Pratik sir, and most importantly, the entire ground team to make it happen. Big thanks to Supriya ma'am for giving opportunity again. Thank you so much, everyone. Stay home, stay safe. Take care.
Thank you, sir.